Scoliosis is a curvature of the spine when looking at a person from the front. The spine may deviate to the left, deviate to the right, or deviate in both directions. For people with scoliosis, the symptoms may vary. There may be no effects whatsoever and only cosmetic deformity. For others, there may be accompanying pain, chest pain, headaches, neck pain, back pain, abdominal pain, leg pain. The effects can vary from individual to individual. The treatment associated with scoliosis is many and varied, but typically, once a scoliosis is identified, a watch and wait scenario is presented. That essentially means that a client is told to wait for the curve to progress. This is a very unsatisfactory direction given or recommendation for how to proceed with scoliosis management. Invariably, curves do progress, especially with those people who are at high risk. It's important to be able to do something during this phase because all large curves start from smaller curves. It's here that a window of opportunity is missed if you follow the watch and wait recommendation. A second recommendation, once scoliosis is identified, is that the curve may be braced. This may follow a rigid bracing for larger curves or a soft bracing such as the spine core bracing for smaller curves between 10 and 30 degrees. Bracing is an aggressive therapy in that it consumes much of your time. Up to 23 hours per day is spent in a brace. The success of bracing is questionable. 2 years after a brace is removed, only 17% of curves will hold their corrected values. For curves between 15 and 30 degrees, 81% of curves following the spine core bracing are going to have success. The definition of success for bracing treatment is 5 degrees progression or less. And it's important for patients to know that bracing itself has very limited success. After 2 years, once the brace is removed, only 24% of people in between 10 and 30 degrees are going to hold their corrected values. All other curves will progress. It's even worse for larger curves. Between 30 degrees and 40 degrees, only 16% of those people will hold their corrected values. For those curves that have been unsuccessfully treated through bracing, surgery is presented as a final option. The definition of success at St. Jude's means that your curve is reduced, that your spine is centred, and that your quality of life improves. At St. Jude's Clinic, we believe the causes of scoliosis are largely determined by how we interact with our environment. We take a look at things like using mobile phones, the way in which you sit, the way in which you sleep, the way in which you study, the way in which you sit on your lounge chair. Many opportunities exist for the curve to progress because of how we interact with our environment. That means that behaviours themselves are crucial in terms of identifying what causes scoliosis and correcting scoliosis. We treat scoliosis by sitting clients down for an hour and looking at various ways in which they interact with their environment. Once those factors have been identified, we then take a look at X-ray analysis. That X-ray analysis targets deviation of the spine from centre, rotation of the spine, and measurements of angles. From there, we then take a look at a vectored approach to be able to centre the spine, derotate the spine, and hold the spine in place using a twofold approach, which is what to do and what not to do. Specific exercises are used to be able to retrain muscles to hold the spine in place and to bring the spine back to centre. Those specific exercises can also incorporate derotational forces which actually derotate and remove the twist from the spine. It's important that both these exercise approaches also are combined or complemented by what not to do. What not to do is a professional analysis as to key behavioural factors that actually cause curve progression in the first place. At St. Jude's Clinic, we are specialists in the field of looking at behaviour and how that behaviour affects your structure and also your function. It's important also to note that you are empowered, not disempowered by watching and waiting. or having a brace wrapped around you for 23 hours a day. You must take these measures in hand, otherwise the chances of progression are significantly high. 50% of all curves that are above 40 to 50 degrees are going to progress, regardless of bracing. 30% are going to progress if you're in between 30 and 40 degrees. These are real statistics, and we need a new approach, an approach that gives you a new hope for managing your scoliosis. It's vitally important that you do something about it now.